Hey, Alpha Nurses, I'm Licensure from alphanurseguide.com. This is an NCLEX case study. Without the way, let's get started.
Mr. W is an 83-year-old man who was brought to the hospital from a long-term care facility by emergency medical services after reporting severe dyspnea and shortness of breath. He has been experiencing cold-like symptoms for the past 2 days. He has a productive cough with thick yellowish sputum. When Mr. W awoke in the nursing home, it was found that he was having difficulty breathing, even after using his albuterol metered dose inhaler. He appears very anxious and is in respiratory distress. His history includes chronic obstructive pulmonary disease, related to smoking 2 packs of cigarettes per day, since he was 15 years old. He quit smoking 2 years ago, when he was admitted to the long-term facility. Mr. W has been incontinent of urine and stool for the past 2 years. In the emergency department, Mr. W undergoes chest radiography, and admission laboratory tests are performed, including serum electrolyte levels and a complete blood count. A sputum sample is sent to the laboratory for culture and sensitivity testing and gram staining. Mr. W's vital sign values are as follows: blood pressure 154/92, heart rate 118 beats per minute, regular, O2 saturation 88%, on 1 liter per minute oxygen by nasal cannula, respiratory rate 38 breaths per minute, and temperature 100.9 degrees Fahrenheit. Question 1. For each nursing action listed below, check to specify whether the action is essential, non-essential, or contraindicated. 1. Place on cardiac monitor. 2. Get a baseline set of vital signs. 3. Draw admission laboratory tests. 4. Place a saline lock. 5. Send for a chest X-ray. 6. Order a lunch tray. 7. Increase oxygen to 2 liters per nasal cannula, as ordered by the emergency department's health care provider. 8. Keep head of bed elevated at least 45 degrees. 9. Place a urinary catheter with a drainage bag. Correct answers. 1. Place on cardiac monitor, essential. 2. Get a baseline set of vital signs, essential. 3. Draw admission laboratory tests, essential. 4. Place a saline lock, essential. Correct answers. 5. Send for a chest X-ray, essential. 6. Order a lunch tray, non-essential. 7. Increase oxygen to 2 liters per nasal cannula, as ordered by the emergency department's health care provider, essential. 8. Keep head of bed elevated at least 45 degrees, essential. 9. Place a urinary catheter with a drainage bag, contraindicated. Rationale. Baseline data that are essential to decisions for the care of this patient take priority currently. These include vital signs, cardiac rhythm, lab values, and chest X-ray findings. Placement of a saline lock is essential for administration of fluids and emergency drugs. The patient's oxygen saturation is only 88% on 1 liter, so increasing it to 2 liters may improve oxygenation, as may elevating the head of the patient's bed. Ordering a lunch tray may be premature, because the interventions for this patient's care are undecided when he is first admitted to the emergency department. Placing a urinary catheter may lead to a urinary tract infection. Question 2. What is the priority nursing concern for this patient? 1. Skin care because of incontinence. 2. Clearance of thick secretions. 3. Rapid heart rate. 4. Elevated temperature. The correct answer is 2. Clearance of thick secretions. Rationale. The patient's major problems at this time relate to airway and breathing, including thick sputum, difficulty breathing, and respiratory distress. The patient's skin care, blood pressure, and elevated temperature will need to be followed up on soon, but are not as urgent at this time as his respiratory status. Question 3. The nurse assesses Mr. W in the emergency department. Which assessment findings are consistent with a diagnosis of COPD? Select all that apply. 1. Enlarged neck muscles. 2. Forward bent posture. 3. Respiratory rate 15 to 25 breaths per minute. 4. Inspiratory and expiratory wheezes. 5. Blue-tinged dusky appearance. 6. Symmetrical lung expansion. The correct answers are 1. Enlarged neck muscles, 2. Forward bent posture, 4. Inspiratory and expiratory wheezes, and 5. Blue-tinged dusky appearance. Rationale. The presence of wheezing, enlarged neck muscles, bluish dusky appearance, and forward bent posture are all classic manifestations in a patient with COPD. The respiratory rate is usually higher than normal, and during an exacerbation can be as high as 30 to 40 breaths per minute. Lung expansion in patients with COPD is usually asymmetrical. Question 4. The healthcare provider's prescribed actions for this patient include all of the following. Which intervention should the nurse complete first? 1. Send an arterial blood gas sample to the laboratory. 2. Schedule pulmonary function tests. 3. Repeat chest radiography each morning. 4. Administer albuterol via MDI 2 puffs every 4 hours. The answer is 1. Send an arterial blood gas sample to the laboratory. Rationale. Baseline ABG results are important in planning the care of this patient. The unit clerk can schedule the pulmonary function tests and chest radiography. The albuterol therapy is a routine order, and the patient may need this after the ABG is drawn.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Mr. W's ABG results include the following: KH 7.37, arterial partial pressure of carbon dioxide 55.4 mm of mercury, arterial partial pressure of oxygen 51.2 mm of mercury, and bicarbonate level 38 milliequivalents per liter. Question 5. What is the nurse's interpretation of these results? 1. Compensated metabolic acidosis with hypoxemia. 2. Compensated metabolic alkalosis with hypoxemia. 3. Compensated respiratory acidosis with hypoxemia. 4. Compensated respiratory alkalosis with hypoxemia. The correct answer is 3. Compensated respiratory acidosis with hypoxemia. Rationale. The pH is on the low side of normal, and the PaCO2 is elevated, which indicates an underlying respiratory acidosis. The HCO3 level is elevated, which indicates compensation, and since the pH is within normal limits, it is completed compensation. Both the PaO2 and the oxygen saturation levels are low, which points to hypoxemia. These blood gas results are typically expected when a patient has a chronic respiratory problem, such as COPD. Question 6. Based on the patient's ABG results, what are the nurse's priority actions at this time? Select all that apply. 1. Administer oxygen at 2 liters per minute via nasal cannula. 2. Initiate a rapid response. 3. Teach the patient how to cough and deep breathe. 4. Begin IV normal saline at 100 milliliters per hour. 5. Arrange a transfer to the intensive care unit. 6. Remind the patient to practice incentive spirometry every hour while awake. The correct answers are 1. Administer oxygen at 2 liters per minute via nasal cannula. 2. Initiate a rapid response. 3. Teach the patient how to cough and deep breathe. And 6. Remind the patient to practice incentive spirometry every hour while awake. Rationale. The patient's major problem at this time is impaired gas exchange with hypoxemia, based on the ABG results. Strategies to compensate include administration of low-flow oxygen, as well as interventions to improve gas exchange, such as having the patient cough and take deep breaths and perform incentive spirometry. These strategies may improve the patient's condition and prevent the need to initiate a code transfer to the ICU or both. A rapid response is for hospitalized patients with early signs of deterioration on non-ICU patients to prevent respiratory or cardiac arrest. The patient's symptoms call for initiation of a rapid response to treat him now and prevent the need for a code. A saline lock is a good idea, but giving the patient too much fluid may worsen his condition by producing a fluid overload. Transfer to the ICU at this point is not warranted because the patient is unstable. After the rapid response, the respiratory therapist provides the patient with a handheld nebulizer treatment, and Mr. W is stable enough to be admitted to the acute care unit. Question 7. Which interventions would the nurse delegate to an experienced assistive personnel? Select all that apply. 1. Changing the patient's incontinence pad as needed. 2. Performing pulse oximetry every shift. 3. Teaching the patient to cough and deep breathe. 4. Reminding the patient to use incentive spirometry every hour while awake. 5. Assessing the patient's breath sounds every shift. 6. Encouraging the patient to drink adequate oral fluids. The correct answers are 1. Changing the patient's incontinence pad as needed. 2. Performing pulse oximetry every shift. 4. Reminding the patient to use incentive spirometry every hour while awake. And 6. Encouraging the patient to drink adequate oral fluids. Rationale. Assisting patients with activities of daily living, such as toileting, is within the scope of practice of APs. After licensed nurses or RTs have taught the patient to use incentive spirometry, the AP can play a role in reminding the patient to perform it. APs can participate in encouraging patients to drink adequate fluids. Assessing and teaching are not within the scope of practice of APs. Performing pulse oximetry is appropriate for experienced APs, after they have been taught how to use the pulse oximetry device to gather additional data. Before delegating this task, the nurse would be sure to assess the AP's skills. Question 8. Mr. W's lab values include a serum potassium of 2.8 mg per deciliter. What is the priority nursing action at this time? 1. Teach the patient about potassium-rich foods. 2. Provide the patient with oxygen at 2 liters per nasal cannula. 3. Contact and notify the HCP immediately. 4. Initiate 0.9% saline at 20 milliliters per hour. The correct answer is 3. Contact and notify the HCP immediately. Rationale. A low serum potassium places the patient at risk for cardiac dysrhythmias, which can be life-threatening. The HCP should be notified immediately and will likely order IV or oral potassium supplements to move the patient's level back into the normal range. Later, before discharge, the nurse would certainly want to teach the patient about potassium-rich foods, but this is not urgent. Oxygen is essential for the patient's respiratory problem, but will not correct the low potassium, nor will IV normal saline.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Question 9. Mr. W is receiving an IV dose of potassium, 10 milliequivalents per 100 milliliters normal saline, to run over 1 hour. The AP asks the nurse why it takes so long to infuse such a small amount of fluid. What should the nurse explain to the AP? Select all that apply. 1. IV potassium is very irritating to the veins and can cause phlebitis. 2. Tissue damaged by potassium can become necrotic. 3. Oral potassium can cause nausea, so IV potassium is preferred. 4. The maximum recommended infusion rate for IV potassium is 5 to 10 milliequivalent per hour. 5. That's a good question, and I will ask the HCP if I can give the drug IV push. 6. The goal is to prevent infiltration into the tissue. 7. The patient is not taking in sufficient dietary potassium to keep the level within normal limits. 8. Giving the potassium slowly will give us time to teach the patient about dietary sources of potassium. The correct answers are 1. IV potassium is very irritating to the veins and can cause phlebitis. 2. Tissue damaged by potassium can become necrotic. 4. The maximum recommended infusion rate for IV potassium is 5 to 10 milliequivalent per hour. And 6. The goal is to prevent infiltration into the tissue. Rationale. A dilution no greater than 1 milliequivalents of potassium to 10 milliliter of solution is recommended for IV administration. The maximum recommended infusion rate is 5 to 10 milliequivalents per hour. This rate is never to exceed 20 milliequivalents per hour under any circumstances. Pain at the site of injection and phlebitis may occur during intravenous administration of solutions containing 40 milliequivalents per liter or more of potassium per liter. Potassium is not given by IV push to avoid causing cardiac arrest. Potassium-containing solutions are intrinsically irritating to tissues. Therefore, extreme care should be taken to avoid perivascular infiltration. Local tissue necrosis and subsequent sloughing may result if extravasation occurs. Oral potassium can cause nausea and vomiting, but this does not answer the AP's question. Lack of dietary intake and teaching about dietary sources of potassium do not answer the AP's question. Question 10. During morning rounds, the nurse notes all of these assessment findings for Mr. W. Which finding indicates a worsening of the patient's condition? 1. Barrel-shaped chest. 2. Clubbed fingers on both hand. 3. Crackles bilaterally. 4. Frequent productive cough. The correct answer is 3. Crackles bilaterally. Rationale. Barrel chest and clubbed fingers are signs of chronic COPD. The patient had a productive cough on admission to the hospital. Bilateral crackles are a new finding and indicate fluid-filled alveoli and pulmonary edema. Fluid in the alveoli affects gas exchange and can result in worsening ABG concentrations. Question 11. The nurse reports the morning assessment findings to the HCP. Which prescribed intervention is most directly related to the nurse's assessment findings? 1. Administer furosemide 20 mg IV push now. 2. Keep accurate records of intake and output. 3. Administer potassium 20 milliequivalents orally every morning. 4. Weigh the patient every morning. The correct answer is 1. Administer furosemide 20 mg IV push now. Rationale. Furosemide is a loop diuretic. The uses of this drug include treatment of pulmonary edema, which is most directly related to the new finding. Intake and output records and daily weights are important in documenting the effectiveness of the medication. A side effect of this drug is hypokalemia, and some patients are also prescribed a potassium supplement when taking this medication. Question 12. Which assessment finding would the nurse instruct the AP to report immediately? 1. Incontinence of urine and stool. 2. 1 pound weight loss since admission. 3. Patient cough productive of greenish-yellow sputum. 4. Eating only half of breakfast and lunch. The correct answer is 3. Patient cough productive of greenish-yellow sputum. Rationale. The patient's temperature was elevated on admission, and his cough was productive. The changes in Mr. W's sputum could indicate an ongoing infection. The HCP needs to be notified, and an appropriate treatment plan started. All of the other pieces of information are important but not urgent. The patient's incontinence is not new.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Question 13. The AP checks morning vital signs and immediately reports the following values to the nurse. Which takes priority when notifying the HCP? 1. Heart rate of 96 beats per minute. 2. Blood pressure of 160/90 mm of mercury. 3. Respiratory rate of 34 breaths per minute. 4. Oral temperature of 103.5 degrees Fahrenheit. The correct answer is 4. Oral temperature of 103.5 degrees Fahrenheit. Rationale. The heart rate and blood pressure are slightly increased from admission, and the respiratory rate is slightly decreased from the admission rate. The continued elevation in temperature indicates a probable respiratory tract infection that needs to be recognized and treated. Question 14. The nurse administers the patient's first dose of IV cefotaxime. Within 15 minutes, Mr. W develops a rash with fever and chills. What is the nurse's first action at this time? 1. Discontinue the IV infusion. 2. Administer 2 tablets of acetaminophen. 3. Measure the area of the rash. 4. Check for numbness and tingling. The answer is 1. Discontinue the IV infusion. Rationale. Serious side effects of cefotaxime include rashes, fever, and chills, as well as diarrhea, bruising, numbness, tingling, and bleeding. If the patient is taking this drug as an outpatient, the HCP should be notified immediately. Because the drug is being given IV, the first step would be to stop the infusion. The HCP should be notified, and the patient should be assessed for additional symptoms of a serious reaction to the drug. The HCP will prescribe a different antibiotic for the patient. Question 15. The nurse observes the patient's use of the albuterol metered dose inhaler. The patient takes 2 puffs from the inhaler in rapid succession. Which intervention takes priority at this time? 1. Call the pharmacy to request a spacer for the patient. 2. Notify the provider that the patient will need to continue receiving nebulizer treatments. 3. Ask the AP to help get the patient into a chair. 4. Instruct the patient about proper techniques for using a metered dose inhaler. The correct answer is 4. Instruct the patient about proper techniques for using a metered dose inhaler. Rationale. The patient is demonstrating improper use of the MDI by taking 2 puffs in rapid succession, which can lead to incorrect dosage and ineffective action of the albuterol. Teaching is the first priority. The patient is taught to wait for at least 1 minute between MDI puffs. As the nurse works with this patient, it may be determined that he would benefit from the use of a spacer. Sitting up in a chair may also be useful, but these interventions are not the first priority. Notifying the provider that the patient needs to continue with nebulizer treatments is not within nursing scope of practice and does not address the problem, which is that the patient does not know how to properly use his MDI. Question 16. Mr. W has lost 15 pounds over the past year. On assessment, he tells the nurse that his appetite is not what it used to be, and he becomes short of breath while eating. Which interventions should be included in his nursing care plan? Select all that apply. 1. Initiate a dietary consult. 2. Stress that he must eat all of his meals, or he'll become malnourished. 3. Monitor serum prealbumin levels. 4. Suggest 4 to 6 small meals per day. 5. Instruct the patient to use his bronchodilator 30 minutes before meals. 6. Encourage dry foods to avoid coughing. The correct answers are 1. Initiate a dietary consult. 3. Monitor serum prealbumin levels. 4. Suggest 4 to 6 small meals per day. And 5. Instruct the patient to use his bronchodilator 30 minutes before meals. Rationale. A dietitian can help with the selection of foods that are easy to chew, do not form gas, and are high in calories and protein. Serum prealbumin levels are a good indicator of nutritional status and should be monitored. Small meals can help prevent meal-related dyspnea. Using a bronchodilator before meals will reduce bronchospasm. The second response does not demonstrate respect for the patient's role in his care. Dry foods stimulate coughing.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Question 17. The AP tells the nurse that Mr. W is unable to complete his morning care without assistance and wonders if he is being lazy. What is the nurse's best response? 1. Encourage the patient to do as much as he can as quickly as he can. 2. If the patient is short of breath, increase his oxygen flow. 3. Remind the patient to take his time and not to rush his morning care. 4. He may not need as much help as he is asking for, so try to get him to do more. The correct answer is 3. Remind the patient to take his time and not to rush his morning care. Rationale. The patient with COPD often has chronic fatigue and needs help with activities. Teaching the patient not to rush through activities is important. Rushing increases dyspnea, fatigue, and hypoxemia. Reminding a patient of what has already been taught is within the scope of practice for an AP. Patients with COPD should be kept on low-flow oxygen because their stimulus to breathe is a low arterial oxygen level.
You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguide.com.